You may lose up to 100 hairs every day. Did you know that's normal? But if you start losing a lot of hair, it might be time to look into it more. There are many things that can cause hair loss, such as genes, male and female pattern baldness, health problems, alopecia areata, not getting enough nutrients, or even some medicines. Figuring out the exact reason is important because the treatments will be different. Making small changes to your daily habits, like not using too much heat on your hair and starting to live a healthier life, can also make a big difference. This video will talk about what causes hair loss and how to successfully manage and treat it. Causes of hair loss. Number 9, androgenetic alopecia. A lot of people lose their hair because of androgenetic alopecia, which is also called male or female pattern baldness or inherited alopecia. Depending on your gender, this genetic condition shows up in different ways. Men usually lose hair from the temples and the top of their heads, while women usually lose hair all over their skin. Androgenetic alopecia is more likely to happen as a person ages, but it can start at any time after puberty and is common in women after menopause, which suggests that hormones may play a role in how it develops. Minoxidil, Rogaine, Loniten, is one way to treat androgenetic alopecia, but it can take 6 to 12 months for hair to grow back in a noticeable way. Finasteride, Propecia, is another drug used to treat male pattern baldness. Aldactone is another drug used to treat female pattern baldness. Laser therapy, platelet-rich plasma injections, and hair graft surgery are some other options. Some nutritional products may also help your hair stay healthy. Number 8, pregnancy. During pregnancy, your hair might look bigger, but soon after giving birth, many women lose a lot of hair because their estrogen levels drop. Luckily, this kind of hair loss only lasts for a short time and goes away in about a year. During this time, you might want to use items made especially for fine hair to help give your hair more volume. Shampoos and conditioners that add volume are a better choice than intense conditioners or conditioning shampoos, which can make fine hair feel too heavy. To keep your hair from getting too heavy, focus on the ends when you apply conditioner instead of the head. Number 7, Telogen effluvium. If your hair stays in the telogen phase, which is the normal shedding phase of hair growth, you may lose more hair than usual, sometimes even whole bunches. This is called telogen effluvium. In healthy hair follicles, there are 4 stages. The Anagen phase is when the cell actively pushes out hair, which grows. The catagen phase is when growth slows down. The telogen phase is when hair starts to fall out. And the exogen phase is when hair growth speeds up. Telogen effluvium can be caused by giving birth, surgery, a lot of worry, losing a lot of weight quickly, thyroid problems, or some medications. Number 6, Anagen effluvium. Anagen effluvium is a condition in which you lose a lot of hair very quickly during the growth part of your hair cycle. This can hurt not only the hair on your head, but also the hair on your body, like eyelashes and eyebrows. Cancer treatments like chemotherapy and radiation, fungal infections, and autoimmune diseases can all cause anagen effluvium. The best way to treat this problem depends on what's causing it, but a topical solution like minoxidil, Rogaine, may help. It might help to keep your head cool during chemotherapy if you are losing your hair because of anagen effluvium. Usually, hair starts to grow back 3 to 6 months after chemotherapy is over. Number 5, alopecia areata. When you have alopecia areata, your immune system attacks your hair follicles by mistake, which makes your hair fall out all of a sudden. This can happen on the scalp, eyebrows, and eyelashes, and hair will usually fall out in small spots. Injections of corticosteroids into the scalp or other medicines recommended to help your hair grow back may be part of your treatment. Number 4, birth control pills. A lot of people say they lose their hair while taking birth control pills, and for some, the problem lasts for weeks or months after they stop taking them. To lower this chance, it's best to choose pills with a low androgen index. Pills with a lower androgen index like Desogen, Orthocept, and Orthocycline might be better for people who are worried about hair loss. On the other hand, Overal and Lostrin are known to have a higher androgen index, which means they may raise the chance. Number 3, hair loss and nutritional deficiencies. Nutritional deficits, especially in protein and iron, can cause hair loss. Extreme diets lacking these minerals might cause considerable hair loss. See a doctor for a blood test to check if a deficit is causing hair loss. The results may suggest dietary changes and supplementation to restore hair health. Number 2, ringworm and hair loss. Ringworm, especially Tinea capitis, can cause transient but dramatic hair loss. Hair follicles weaken and shed due to this fungal infection. Ringworm is characterized by scaly, ring-like spots on the scalp or skin, growing hair loss, seeping blisters, itching, and brittle hair. Infection treatment and hair loss prevention require immediate medical attention. Number 1. Traction alopecia. When you wear tight hairstyles like buns, ponytails, braids, cornrows, or extensions, the hair breaks and comes loose, causing traction alopecia. The disorder may cause patches of hair loss and overall thinning. Avoid tight hairstyles that strain your scalp and hair follicles to safeguard your hair. The life cycle of your hair. The life cycle of your hair consists of 3 distinct phases that ensure continuous growth and replacement of hair. During the Anagen phase, which lasts between 2 and 8 years, about 90% of the hair on your head is actively growing. Following this is the catagen phase, a transition period lasting 2 to 3 weeks, during which your hair follicles shrink and hair growth ceases. Finally, the telogen phase is a resting period lasting 2 to 4 months, after which the hair strands fall out to make way for new growth. If you are suffering from hair fall and want to know about 7 amazing foods that stop hair fall, then go to the link in the description and watch our complete video. How to treat hair loss, know your options. Number 3, addressing the root cause. Your doctor will focus on these underlying issues if your hair loss is caused by medications, hormonal imbalances, thyroid problems, or changes in your diet. If you fix the cause of your hair loss, it will often stop or greatly slow down. Number 2, treatments for androgenic alopecia. For both men and women with pattern baldness, over-the-counter topical solutions like minoxidil, Rogaine R, are often the first step. These are applied straight to the scalp. Finasteride, Propecia R, an oral prescription drug, may also be suggested for men who have male pattern baldness. Number 1. Hair transplant procedures. During a hair transplant, your doctor will take hair strands from an area of your head that has a lot of hair and move them to an area where there aren't as many hairs. By rearranging your own hair, this method can effectively improve hair coverage. Hair loss can be caused by many things, such as genetics, androgenetic alopecia, changes in the body, medical treatments, or ways of living. Depending on the cause, effective treatments can include things like minoxidil that you put on your hair, changes to your diet, and even surgery like hair transplants. To get the right treatment, it's important to figure out why you're losing your hair. Don't forget to share, subscribe, and leave a comment to get more interesting information like this sent to you.